Alright, so I'm going to talk about muscle activity in the gait cycle. So starting with actually just prior to heel strike, your hamstring muscles are active, and they're actually active to kind of de-accelerate the leg as it comes in for that heel strike. At heel strike, at the hip, you have your gluteus maximus turned on to take that weight, and actually just prior to heel strike, your gluteus maximus turns on to kind of keep you upright. You also have your abductors, your gluteus medius and your gluteus minimus. They're also going to be on its stance for the same reason, to take that weight, only they're in the frontal plane instead of the sagittal plane like the gluteus maximus. And then you also have your quadriceps that are going to be active, and they're going to be active to take the weight at the knee. Okay? So as you're coming into that heel strike, the hamstrings are actually active eccentrically, okay, because they're trying to slow things down. As you go into that heel strike, it's all the gluteus maximus, the medius, and the minimus. They're going to be the maximus is going to be concentrically active to keep yourself upright. The medius and the minimus are actually eccentrically active, and that's because they're going to kind of take the weight. Okay, the quadricep muscle is going to be eccentrically active because remember, you're flexing a little bit. Okay, it's going to take the weight. Okay. And then as you go from that initial, that heel strike and loaded response to mid-stance, the quadricep muscle is going to actually be active concentrically to kind of straighten you up. Okay? As you go from mid-stance, to heel off, your hip flexors are going to be active eccentrically to control that hip extension. Okay? And then they're going to turn around and be concentrically active to begin the swing phase. Okay? So again, at the hip in particular, you have the hamstrings eccentrically active to control that heel strike. You have the gluteus maximus concentrically active to take your weight, and then the medius and the minimus also to help take your weight. And then you have the quadriceps active also to take your weight. So again, the medius and the minimus and the quadricep muscle, they're going to be active eccentrically. Okay, so remember, you're flexing a little bit, you're adducting a little bit. They want to take your weight, so it's a gentle kind of thing. And then they're going to turn around and kind of straighten you back up again. Okay, the hip flexors are going to turn on not until mid-stance. When you begin to extend, they're going to be active eccentrically to control that, and they're going to turn around and be concentrically active to pull your femur forward. At the ankle, so as you bring your foot down, okay, and you slowly lower your foot, that's actually your as you lower yourself into plantar flexion, that's your anterior tib, which is active eccentrically. Remember to control that plantar flexion. As you go through stance phase, most of stance phase, you're actually dorsiflexing, and that's a controlled dorsiflexion with gravity. So it's your plantar flexors, which is your gastric and your soleus, that are controlling that tibial movement. So the gastric and the soleus are going to be eccentrically active through that stance phase until you do push-off. Okay, so remember we said that you are dorsiflexing until you're plantar flexing, so they're going to control that dorsiflexion, and they're going to turn around and be concentrically active to push off. Also at the foot now, as you put your foot down, remember you're everting through stance, and then you invert right before you push off. That's all controlled by the posterior tib. So the posterior tib is your primary inverter. Okay, so as you bring your weight down, the posterior tib is going to control your eversion, and then it's going to turn around and act concentrically to supinate the foot and prepare it for push-off. So the thing to think about is that, as you can tell, there's a lot of eccentric followed by concentric. Okay, so at the knee, at the quads, they're primarily responsible for controlling your weight. Okay, so that eccentric activity when you first start stance, and they'll turn around and be concentrically active to hold you up. The posterior tib is going to be eccentrically active to take the weight at the foot, really in the same way as a quadricep muscle, and then it's going to turn around and be concentrically active to help push you off. The anterior tib is going to be eccentrically active to kind of lower that foot, and then eventually when you get to swing, you'll have some concentric activity to help lift it up. One muscle you don't hear a lot about is the hamstring muscle, and the hamstring muscles are not actually super important for gait per se. The only time they're really active is, like I said, when you go into that heel strike, they actually kind of slow down the whole leg to get you ready. We call it a heel strike, but it's actually very controlled. It's a very controlled movement, and it's controlled by the hamstrings. But outside of that, they're not super active. The flexion that happens when you transition from that stance to swing doesn't come from active hamstring activity. It comes primarily through intersegmental forces and passive tension. Okay. And once you start the swing phase, so like I said, you have your hip flexors to get you started. You have a little bit of activity in the foot to hold it up. Basic momentum takes you forward from there. Okay, so that phase from post early swing until you start preparing for that next heel strike is mostly just momentum, and there's not a lot of activity in that phase. And that's muscle activity of the gait cycle.